Добрий день і вітаю.
Good afternoon. Thank you for joining us in Ukraine Media Center Ukrinform. My name is Ola Atamanova, and today we have invited you for the presentation of advocacy campaign called Breathe, which is aimed at respiratory support of the population. We will talk about the importance of respiratory support of the population, and we will talk about this campaign in general. And I want to introduce our speakers. Today joining us are Vitaly Svichynskyi, Director at RAZOM Health Program at RAZOM for Ukraine Charity Foundation. Also joining us is Dmytro Lufer, a health expert and coordinator of Breathe Advocacy Campaign. Svitlana Solovyova, pediatrician, expert on scientific issues and international experience at Breathe Advocacy Campaign. And Andiy Mechev, doctor, expert on organizational issues and international experience of Breathe Advocacy Campaign. It's my pleasure to see all of you here. Mr. Vitaly, probably the first question I want to ask you, why is this campaign important? Why is it important to implement the respiratory support of the population? Good afternoon, everybody. First, I would like to explain what is respiratory support. In fact, is the machine support of the patients with the chronic diseases of respiratory system. There is a very broad range of patients in Ukraine who require such support, and we advocate to have this support provided at home, to implement the systemic coordination of work with the patients who have some respiratory diseases. I would like to share my personal history. Why am I here? Back in year 2020, my child was born with the spinal muscle atrophy. You probably remember that campaign when the 2 million hryvnias were raised for one injection for my child. Obviously, we raised the amount. Currently, Dima is undergoing rehabilitation, and I want to thank all of the Ukraine for making it, but we were not talking about the primary problems that patients with this diagnosis may have, and what should the state do? How should they act in this aspect? I would like to say that de facto my child had respiratory problems with the muscle system, and there was no single specialist in Ukraine who would understand how a small child can be connected to invasive or non-invasive lungs ventilation system. In our case, my kid should have been connected to BiPAP machine that would have support the breathing of Dmytro, and he would feel easier to experience his disease. In Ukraine, we were able to find only 3 specialists who would have been able to organize this process. In the United States, it's a very extensive service, and when we were undergoing treatment in the United States, a child was connected to the machine just within 5 minutes, to the BiPAP machine, and then they could sleep normally, get reinvigorated. But the consequences of untimely connection to the machine is the deformation of chest, which is very difficult to correct then. And those changes happened because there was no professional help available in Ukraine. On my part, I was always dreaming about such service to emerge in Ukraine. The therapists who could support such patients could be trained, and there is a huge statistics all around the world. There is a large number of people in the world with respiratory problems, if we look at this problem on a more profound level. And me, as the director of RAZOM for Ukraine, RAZOM Breathe program, I was bringing up this issue inside the organization for a number of times. I was reiterating that it's an emergency condition. The respiratory diseases, you remember COVID-19, you remember all the problems that emerged with the respiratory health. I was advocating this project inside of our organization, and thanks to the people who gathered here today and a large team of people, we have initiated those processes, and I hope we are about to make it in Ukraine. Thank you very much, Mr. Dmytro. Let's talk a little bit more about this campaign. What are the goals that you set for yourself, and what are your expectations? Good afternoon, everybody. So when we talk about advocacy campaign, it's a very broad notion, and our main goal is to have the systems of respiratory support emerge in Ukraine on a government level, which would include funding on a state level, but it's not only limited to money here. We understand that currently we don't have a system in place to provide people with the equipment. This equipment is supposed to be issued to the people. It should be maintained. It requires again the maintenance specialist. And solution of this issue in Kiev only is not a solution for all of the patients. Now we're facing the fact that there is no even the adequate statistics around the country. So currently the state doesn't take a lot of care of this matter. So talking about advocacy, first of all, we have to raise awareness, because it's a catastrophic amount of expenses for the people who are facing those problems. And even if people manage to raise the funds through different charity foundations, the absence of the system, the absence of the machines, the absence of the specialists in the regions, it just nullifies all the efforts, because even with the money, people cannot ensure proper support to their relatives. So first we want to raise awareness, then we want to help the government to build the system. We study the foreign experience. There are countries where this system already exists. There are countries which have implemented this system just recently. We help with the calculations, what is the cost of the case, how to calculate it, so the government can predict, calculate their expenses, forecast the expenses, add them to the budget to see how it happens. And also we advocate among the doctors, and we advocate for the creation of the system of training, so that the doctors are ready to such patients. And when we put it all together, the network, equipment, specialists, the state financial support, this is when the system will start operating. And yet another part of the system is the protocols, medical standards and protocols. This is where we advocate the adding of respiratory support, because this is what the doctors use in their day-to-day operation. Mr. Dmytro, then the logical question is whether our system is ready from the legal standpoint, or should we work in this area too? Yes, this is the part of our job. We have lawyers on our team, because in fact there is no such specialty as the respiratory therapist in Ukraine, which exists in many other countries. Also, the standards stipulate that the respiratory support of the adults is performed by the anesthesiologists. We understand that it's a deficit specialty. Further on, we hardly believe that the anesthesiologists will work around the homes maintaining the equipment, because their workplace is in intense care units. So here we proceed to the training, because a pulmonologist is supposed to be trained to do that. They're not trained to do this on a fundamental level, but the doctors who were coming across such patients, sometimes due to their professional interest, they just learned how to do that. Thank you. Miss Svitlana, I would like to ask you a question. As a doctor, you understand, who faces these necessities, who faces these needs, who needs such support. And Mr. Dmytro also mentioned the training component. Is it possible not to train people from scratch, so to say, or to train a part of the therapists or pediatricians to provide help like that? Or this scheme is not going to work, in your opinion? First of all, when we talk about the groups of patients which require such support, I would like to give a more broad characteristic of what respiratory support is, because it's a whole area of medical activities which includes diagnostics of breathing impairments, diagnostic of breathing impairments during sleep, which is not so widespread in Ukraine currently, then advising to the patients the multidisciplinary training, maintenance of the lungs ventilation machines, manual techniques, the training techniques to help during coughing. And it's a multidisciplinary approach, the cleaning of the breathways, and so on and so forth. So what are the groups of patients who require this? The patients with chronic diseases of lungs. And you know, the lung diseases are one of the priority areas in the area of the healthcare, both in Ukraine and all around the world. It's the Duchenne muscular dystrophy, the muscle atrophy, the injuries of thorax, injuries of neck, injuries of spine, everything that might be related to the warfare. About 15% of such patients require chronic support of breathing. Then obstructive apnea, this is when people breathe bad at night and then they sit at the wheel and they fall asleep at the wheel, which results in traffic accidents. So this should be brought up to a systemic level. Training is necessary on all of the stages for pulmonologists, pediatricians, therapists, even for nurses and physical therapists. Currently we are in the middle of preparing our propositions about how to build the training system, what are the specialties that require more profound support, what is respiratory support and how it should be provided. Ms. Svitlana, Mr. Vitaly mentioned that currently even the number of people who require such support is unknown. Do we at least understand what are the orders? Are they the thousands or hundreds of thousands of people in our country? Well, we're trying to understand the numbers. They are not dozens, not hundreds, because it's related to different types of diseases. Different types of respiratory support will be required for different types of diseases. And it will help us to make more detailed calculation, because obstructive diseases of the lungs is one type of support, and muscle atrophy requires another type of respiratory support. Well, thank you very much, Mr. Dmytro. Maybe you know what is the statistics in our country. What does the international experience tell us? Well, talking about the numbers, 1 in 6 persons has apnea. This is the statistics by the World Health Organization. This is the answer to a question about the number of people. Well, we analyzed the experience of United States, Canada, New Zealand, Europe. The systems are more or less similar all around the world. There are national services like National Health Service of Ukraine, even their equivalents in other countries who pay for the equipment. In some countries, I think in Croatia and Poland, they pay for consumables. So it all happens at the expense of the state. Like Mr. Vitaly said, it's happening in Ukraine at the expense of the charity foundations or or for example, in Scandinavian countries where respiratory support is very widespread, respiratory therapists amount to 40 therapists per 1,000 of population. In some countries, it's 2 or 3 specialists for 1,000 of per 1,000 of population. For example, like in Greece. And talking about the United States, their system is a little bit more complicated. They have Medicaid and Medicare health insurance. You can go to the website of Medicare and there is the very extensive list of what they offer to the patients, starting from consumables, mattresses, and the ending with the equipment itself. Unfortunately, this system is currently non-existent in Ukraine. So in your opinion, what is the experience that we should integrate? What way should we go to build this system in Ukraine? Unfortunately, currently we're seeing that we have gaps in the rehabilitation system, and the multidisciplinary approach is being built there, and we understand that it's not the only area where we have such condition. Well, talking about rehabilitation, there is such a notion, such a phenomena as the respiratory rehabilitation too. No one talks about this in Ukraine so far, but we're on the right way because we have developed the mobile palliative teams. We have developed this project. Those are the teams who come to the people, to their homes to support them. There is the full package of services that you can get familiarized with at the website of the National Health Service of Ukraine. So it's the first step, because in their documentation they already mentioned the lung ventilation systems there. So it's the first step on this way to this big goal, but it's only one machine assigned to one team. But if they have, say, 4 or 5 patients, what should they do then? But it's the first step. It's a good step because the doctors the medics who work there, they are experienced, they have proper training, they have experience of working with the lungs ventilation machines. But the COVID experience demonstrated that the workers of the charity foundations, they can be trained to work with those machines too, even sometimes better than some medics. We can only help with the financial side, with the calculations, maybe with the legal side, and we can support the expansion of this network to provide such services as the respiratory support. Thank you very much, dear colleagues. If you have any questions, please join our conversation. Good afternoon, Olena Sapko, Ukrinform. I would like to ask you, what is the cost of such equipment, first of all? Secondly, it's obvious that those are expensive types of equipment, so have you been looking around the international partners who can support us in this? And another question is, do you see any interest in part of the state in terms of implementation of this project of yours? Well, let's go step by step. Different equipment, if we talk about apnoea, for example, CPAP machines, they are around $4,000, up to $4,000 per machine. And talking about more complicated equipment, more complex things like BPAP, Chauvel, they can start at 10,000 euro per machine. Talking about the international partners, we are already in negotiations with an extensive number of international organizations, including the specialized organizations who express their support, their support of the way that we started. Also, we're talking about some financial support to be provided by those organizations that can be spent for equipment, training of specialists, and so on and so forth. For example, we are in part an international foundation, and we've undertaken a part of the financial costs on ourselves, and we hope that as the campaign develops, more partners will join us. Please. What I would like to add about the interesting part of the state, the studies demonstrate that what the state and the population receive, the domestic lungs ventilation allows improving the lives of the patients, extend the life expectancy, and decrease the costs of the government. The study says that 70 to 80% of the funds can be saved if we do the lung ventilation at home. During our experience, we've come across the British survey. They have the British Healthcare Service, NHS, that pays for all those expenses. So why are we talking about the domestic lungs ventilation? So the difference in their calculations saves about 9,000 British pounds per year per one patient, and 9,000 British pounds is about 1.5 lung ventilation machines. So quite an interesting number. We are already in negotiations with the Ministry of Healthcare of Ukraine. We had a good meeting with First Deputy Minister. We've already identified the steps to implement it. The government is interested about this because the part of those patients, they are in intensive care units. They could be staying at home and thus reducing the costs of the government. And we also talk about the engagement of the patients. If they get this therapy at home, they can continue living their normal lives, that they can service themselves, they can continue working, and they cannot be a burden for the state. So there is interest on part of the Ministry of Healthcare. We'll see how it develops as we proceed to some specific steps like protocols and stuff like that. But currently, since there is no experience in building the system, the state does not understand what are the expenses, because we understand any such input, it should be calculated in financials, in the financial indicators, and we want to make calculations. We want to support the state in this, to scale it, to measure the cases, to scale it up to the country level. And for example, in case of COVID, there was a lot oxygenators procured, the machines which provided the oxygen support, but it turned out that there are no mechanisms in place in the state to issue them to the patients, because it's a utility, like a communal property. So there are some legal gaps, legal barriers on the way to support people at their homes, like issuing the equipment for a patient. So we should help the government to find the way to amend the regulations so we could launch the system. So in many cases, it's not even about the equipment, because the equipment is easy to buy. We need people who know how to work with it. There should be stimuli on part of the medics, so they want to do it, because those are the difficult patients, and the doctors should be trained to do it, to develop, and there should be a regulation that would allow them to do it in a legal way. Mr. Dmytro, it's quite an interesting question. During the wave of COVID, everyone was getting an impression that the number of machines procured was sufficient to support the breathing of the people, but now we understand that it was insufficient. Or is it like we don't have the mechanism to issue them? Well, it's about different types of equipment, because if we talk about COVID, we were focusing on the respiratory support machines, something that is used in intensive care units. But talking about the domestic support, it's different types of equipment which don't require intubation. It's the equipment with the masks that help people stay at homes with the respiratory support, not stay in intensive care unit where it's basically more difficult for them to recuperate, because we understand if people should be staying at home, they should be staying at home. So it's a different equipment, and it's a network which is tied to the places of residence of the people and not to the regional hospitals. Well, we understand that without sustainable changes in approaches, in protocols, this system will hardly start working, because building on the state level will help make this process sustainable. So what will be your further steps to make it happen so that those systemic changes take place? So it's a summary basically of what I was saying is the approach to the protocols, amendment of protocols, expansion of range of specialties who can do that, is the creation of training programs, education programs, and the financial calculations, forecasting of the budget, and propositions of amendment of regulations. If all of those things happen, we will consider it the normal foundation for the system to start working. I think Vitaly may add something. Well, talking about the protocols, my colleagues have already mentioned it, but everything was already invented before us. Europe and the rest of the world, they use the protocols. We can study them, we can pick the best practices and implement them in Ukraine. So the main thing now is to find the normal way, normal protocols. And we were talking to the Ministry of Healthcare. They support us, so we will help them in implementation if it's necessary. Ms. Svitlana? Yes, we are currently preparing in compliance with the legislation. There should be an application submitted for medical and technological documents. I mean, they are the protocols, so we are in the middle of preparing such application. Well, the only thing I wanted to add to finalize it, that I specifically have experience of different advocacy campaigns, and on the example of spinal muscle atrophy, it's a very costly treatment, but you know, that treatment was procured by the state on the state level. So I'm convinced that the systemic work, systemic movement forward, doing this, we can achieve success in Ukraine. And based on my experience of cooperation with the Ministry of Healthcare and other government institutions, I'm convinced that we can always find compromise. I strongly believe it, and I strongly believe we will make it, and we will make another presentation of the newly established system in Ukraine. Thank you very much for the great job you're doing, for your contribution to the building of the healthcare system of Ukraine. Thank you for your indifference. Thank you for the interest, dear spectators and journalists. And we want to thank our security and defense forces for opportunity to hold events like this. Stay tuned. Glory to Ukraine.